I'm here with Courtney Brame, and he's the founder of Something Positive for Positive People. And it is like the coolest story I've ever heard. When I first heard about Courtney and his work, I was just thrilled. So, Courtney, first questions first. What is your organization? Go ahead and tell us about it.
Yeah, Something Positive for Positive People, spfpp.org, is a 501c3 nonprofit organization that aims to minimize stigma, specifically regarding herpes. We support people with yoga therapy, peer support calls. There's a podcast where I interview people who are living with herpes about their experiences, as well as people who are in the health field, because I think that stigma is very multifaceted. We always say sexual health is mental health. So there's sexuality educators, there's mental health professionals, and I'm looking to bring in even more like holistic related practitioners as well. But ultimately, we work directly with people who are living with herpes. We offer educational resources to the partners of people or potential partners of people who might be living with herpes. And we also train healthcare professionals. Actually, February 24th, we had our first in-person training with health professionals at Affirm, Arizona. And this is a reproductive wellness organization. They do STI testing, and what we did was we created some simulation experiences where there's patient actors who have like a backstory, and the practitioner sits across from them. They take a history, and then they have to get the information from them and then either deliver a diagnosis or provide consulting based on the patient's chief complaint. So we were able to launch that. We did that for the first time. I'm waiting on the edits from the videographers so that we can start showing that and starting to replicate it more. I was able to get a grant for that project. So these are the main things that Something Positive for Positive People does. I myself am someone who is living with herpes. I was diagnosed in 2013. It's been 12 years. Yeah, 2013. And when I got my diagnosis, I didn't really have a lot of support. I didn't see that there were any other organizations or even people out there who were openly talking about herpes in the way that I needed to see it for myself. When I got that pamphlet that shows how many people have herpes, that didn't mean anything to me because I don't know any of these people, right? And so as I started to look for more information, there wasn't any. I navigated the dating world as best I could for 4 years from 2013 to 2017. And then I started to just like get curious. I started to engage with people who were living with herpes on social media. And what I found was that there were people with herpes who were struggling with suicide ideation. And so I began to just interview different people about their experiences because I was very curious to what could be causing that. Like, if these are people who just have this virus, this harmless virus, like, why suicide ideation? And I learned that there's so much more to it than sadness, grief, or loss of control. What I find is that there is this deep rooted, intense identity invalidation because a lot of our identity is very much interconnected with our sexuality. And I think that that's really where stigma shows up. It shows up at that intersection because it's not, I have this diagnosis when we get herpes. It's sort of becomes our identity. This is who I am now. No one's going to want me because it is. I'm not going to be in a relationship. Nobody wants this virus. This is now who I am. And so a lot of the work that I do really is getting people to see themselves aside from their sexual selves. And that's even through how we teach people how to talk about their diagnosis when they want to move forward sexually with someone. We try and expand it a bit to see if they're even compatible with the person before getting sexual. We also challenge people's ideas on what sex is and other ways of being able to explore it despite having this diagnosis. So, yeah, I think in a nutshell, like that's it. I host a podcast. I work with people one on one with peer support calls and yoga therapy as a means of helping people through stigma, and then training healthcare professionals on being stigma free with their patients.
So you've been in this world for basically 12 years. You weren't working in the advocacy side of it that whole time. But you would think that we would have made some progress as a society, excuse me, in the past 12 years because people just undoubtedly they have access to more information anyway than they did, 15, 20 years ago. But it feels like, and forgive me for saying this, but like slut shaming and all of these sorts of things, if anything, are getting worse. I see people talking about body count and stuff online. Whenever I see advertisements for companies like ours that does STI testing, it's people, really making ridiculous moral, I don't know, accusations against the people in the advertisements and things like that. Why do you think this hasn't gotten better? I mean, about 50% of people or the so of population has herpes. A lot of them probably aren't even aware that they have it. Probably a lot of the people making stupid comments on the internet have it. Why do you think it's just as difficult today for somebody getting that diagnosis in a doctor's office or just realizing what they have? Why isn't this getting any better in your opinion? Or is it?
I think or is it? That tweaked my answer a little bit. So the answer is both. Depends on what your algorithm is or what ads you're being served, what part of the country you're in. So I am very much learning. Like I can sit right next to someone who has different interests than me. We can type the same thing in the search bar verbatim, and we're going to be delivered to completely different things. I do believe that uh, sex is what's stigmatized. It's not herpes because cold sores are herpes. That's not sexually related. And in an interview I did with a doctor when I first started the podcast, shortly after, I asked him, what's the difference between herpes type 1 and herpes type 2? And he just said to me, he goes, Courtney, the only difference I see is that nobody wants to associate children with an STI or an STD, was how he said it at the time, I believe. And that makes sense because you treat the virus with the same antiviral. You see it express itself the same way. You can pass either type 1, which is primarily oral, to the genitals, where type 2 is the primary one, and vice versa. And in that, there is no real significant difference, but it's more stigmatized to have it genitally. And I believe that that's because of sex. Like sex is stigmatized. You spoke to it earlier. You mentioned the slut shaming, right? Why are we shaming people for their own use of the act of sex outside of the people who are producing the shaming, who are the ones who are fueling stigma, just being uncomfortable with or ignorant to their own relationship to sex and their sexuality. So, on that hand, I think it's getting worse because sex is what's stigmatized. On the other hand, I want to say that things are getting better to another population of people because there are people who are more becoming vocal about their experiences with their diagnosis. If you go online and you look up herpes on any social media platform, you're going to see the hashtag. You'll be able to find people who are open about their experiences, who are dating, who are talking about sharing their status, talking about getting tested for STIs. They're talking about the parts of sex that are related to sexual health, but it's a lot more expansive. And I think that there's a level of comfort that is being created in addition to that safety, where people are able to more mindfully engage with content that isn't fear mongering, that is more hopeful, more positive for these positive people. See what I did there? But yeah, it's both. I really do believe that it's both. And another reason that it's not getting better is because for so many people, if half the population has herpes, like there's a lot of us who, one, don't know, and two, have no reason to be vocal about it, right? Like a lot of us don't have symptoms. The loudest people about this are the ones who are really struggling with this or have the most extreme symptoms. So the general population, someone who gets this is probably not going to want anybody to know. So there's not much advocacy efforts for better medication, better testing, or even a cure. Like there is an organization, Herpes Cure Advocacy, that is working towards getting some type of a cure. But I'll be honest, I don't see this happening in my lifetime because there's so much money to be made by pharmaceutical companies for there not being a herpes cure. So if no one's dying from herpes, like why not just let the stigma stay alive and we continue to push these medications that sometimes work, sometimes don't, and people can keep getting the virus and I have a lifelong pipeline of continuous users of my product.
I want to go back to the doctors for a minute because, we have a team of physicians at shamelesscare.com, and part of our testing, which I want to talk about later, from the standpoint of how gray area it certainly is to be testing somebody who is asymptomatic for herpes virus. But for right now, I want to talk about the doctors because doctors, I think, very much live in this world where, if it's not life threatening or really harmful to your health, they just see it as a data point essentially. Oh, it looks like you got herpes. And the bedside manner is not necessarily doesn't necessarily meet where that person may be emotionally because the doctor realizes, I mean, you said it yourself earlier, it's not a big deal physically, emotionally it really can be. Doctors, I dare say, primarily exist in the physical world, and to them it's not a big deal, so they don't treat it as a big deal, but it can oftentimes leave that patient kind of reeling. No fault of the doctors. It's a tough situation to be in. But what advice do you have for physicians or LPNs or PAs or whoever may be making this diagnosis of herpes with a new patient?
Ooh, so it's not just the doctors, it's also the patient, right? I think that we give a lot of patients a pass, and regardless of, how much nervousness, anxiety, the confusion, the fear of I don't know what's happening with my genitals, I think we have to be mindful of where we go to get tested. So I did a podcast interview with a doctor who spoke to this very beautifully, right? So if I'm someone who, I see a symptom, there's a blister bump on my genital region, I immediately go to the nearest hospital that's open. And let's say it's 1 a.m. on a Saturday, right? 1 a.m. on a Saturday. This is an emergency to me. So I'm going to this emergency room.
Yeah.
Now, you look around the emergency room, you see people who are also having emergencies. This is subjectively an emergency to you. A bump on your genitals is going to be more important than that person you don't know who lost a finger, who might be holding blood
Funny you
from.
should mention that.
Right. Oh, I got to ask about that one. Or who is their bones are sticking out of their leg,
Yeah.
right? So you get called in, you go into the doctor, they ask what brings you in, and you show them a bump, and they go, oh, it's just herpes. When you're the patient and you hear that, it feels very diminishing, it feels devaluing, it feels invalidating to your experience.
Yeah.
And as the doctor, you got to understand this person sees gunshot victims, people who may have stab wounds, who might die and not make it. So when they're saying, oh, it's just herpes, a person who doesn't understand the entirety of the environment might go to, oh my God, that doctor was so stigmatizing. That was the worst service I ever got. But this
Yeah.
doctor's like, oh, thank God it's just herpes. I've been watching people die all night. So here's what the diagnosis is. I'll treat you, and I'll test it to make sure. But here's what I think it is. Here's some information about it, and that's really all in that case. But I say that to say I'd like for patients to also take accountability for understanding where they're going to get tested, right? And also hold their healthcare professionals accountable. I know that in the moment of getting some news like this, especially if your heart's racing, you don't know what's going on, and you have an inkling of something negative happening here for you, then it's going to be a lot more difficult to regulate and be able to hold the doctor accountable and being like, hey, that was a little bit that didn't make me feel good. Like that sucked to hear, right? And then maybe the doctor has no idea that this was anything stigmatizing on their part because they're following their training. And so my advice for the physician or whoever it is that might be delivering the diagnosis is to do so as neutrally as possible. I like to just use people's styles, which is why like the stigma-free trainings that we do are so cool because we get to see people deliver a diagnosis and engage with a patient in a way that flows for them.
Yeah.
Like take aside the using the 6 P's or the 4 C's or the 3 E's or whatever it is that the frameworks of being with the patient, throw that shit out the window. You have a person in front of you. And
Yeah.
this person is a very real situation that's happening. And what I find is that when we can do our best to introduce the diagnosis in a way that doesn't make the patient identify so heavily with the diagnosis, saying something like, I'm trying to go with, I'm using the feedback that I receive, which people want to know what not to say, right? So, uh, delivering the diagnosis while a patient's, exposed, right? They look and go, oh, that looks like herpes. All right, get your clothes on. We're gonna no, right? So we look and we ask, I don't know what the protocol is, but I'm thinking back to how I was diagnosed. I had diagnosed, and the way that I just spoke to you, that was how I was spoken to. Oh, yep, looks like herpes. It's like, that was really casual of you to say.
Yeah.
But what I would have liked was maybe some curiosity questions. How long has this been here, right? If you're asking those questions maybe prior to, and then we get to it, and you can just like be neutral and just objectively stating what's happening. And then when we get the final testing out of the way, like to be told, all right, we did our testing, and based on what we're seeing, this looks like it could be an outbreak of genital herpes. So this genital herpes this outbreak is caused by the virus, HSV. It could be type 1 or type 2, but to understand and give that little bit of a pause too, for where the patient might be hearing that right then and there, or even just be curious. Do you have any recent exposures to herpes? Right? I like the curiosity approach. I think that when you meet people with gratitude and curiosity, that the likelihood of saying the wrong thing, like it diminishes, because you also get to hear the other person speak, what language they use, how they're talking, their cadence, and you can match that.
Yeah, that makes a tremendous amount of sense. I have some information that I'm going to share with the listeners, and Courtney, you may know this or you may not, but it's fascinating to me. One of the things that we're talking to our physicians about is to now you have to understand backstory is, you know, HSV is just one of the 13 infections that we test for, and we're doing blood antibody testing. So people are generally just wanting to be tested for everything. Oftentimes they're not presenting with outbreaks. It's a completely different situation. And because of that, you really have no idea if they do test positive. All you really know is that they've been exposed to HSV enough that their body has created antibodies to it. Technically, they're infected, but they may never be infectious. They may never have outbreaks. This hits people differently than it does others, as you well know. And we certainly don't know which area of the body it's in. But doctors are still really guilty of this idea of if it's HSV2, oh, that's genital herpes. If it's HSV1, oh, that's oral herpes. And the really fascinating thing that's happening, and the research shows this quite clearly, is that in the past 30 years, the number of children with oral herpes, the number of children with HSV1 has decreased by about 30%. I'm not sure why. Maybe people are just more aware, grandma's more aware that cold sore is a type of herpes or that it's contagious. But for whatever reason, more kids are reaching adulthood without the cold sores. And that's great, but it leaves them wide open for contracting it from receiving oral sex as adults. And because of that, the script is really flipped in terms of now with young people, Gen Z, even some millennials, the primary form of genital herpes is HSV1. And that just goes to show that you can really no longer refer to, oral herpes, that's HSV1, or, because the whole thing is just kind of flipped around, which I think is absolutely fascinating.
Yeah, and I mean, it speaks to people's creativity, right? I
Yeah.
think we're seeing people just sex is evolving, it's being normalized, and also there's the whole thing of we are seeing more genital HSV1 cases, right?
Mhm.
Because a lot of people too don't see cold sores as herpes, because a lot of us don't know that you can transmit this oral symptoms of the virus to someone's genitals.
Yeah, absolutely. I want to talk about testing a little bit because, a lot of organizations do not do asymptomatic testing for herpes, and I don't judge them negatively for that. I totally see why. I hinted at it earlier. Just because someone is infected with herpes doesn't mean that they're ever going to be contagious. Doesn't even mean that they're ever going to have an outbreak necessarily. So then what have you told the person? You've told the person that they have herpes. It's not going to impact their life at all, except now potentially emotionally. And so a lot of physicians and clinicians and things like that look at that situation and go, well, what was the point? Was there any upside to that at all? Our customer base just sort of demands it for some reason. Like I would be, as a telemedicine company, I would be totally fine with just doing away because if someone's having serious outbreaks, they're going to find their way to an in-person physician who can then swab it, find out exactly what it is. But people for some reason clamor for this asymptomatic, blood test, and I'm not sure why. And I think if we got rid of it, the feedback would be, oh, you don't care about herpes, you don't care if people spread herpes. But I'm sitting there, looking at the patient's response to the doctor oftentimes, and they're having a panic attack clearly because they got this diagnosis, when the reality is it may not impact their life at all. So, have you taken a stand on asymptomatic herpes testing, or is it something that you get into, or are you just more about the business of, hey, if someone's being diagnosed, I want to help them. I don't get into the politics, if you will, of how people should or shouldn't be tested.
No, I think we just need a better test. I think if enough people complain and do like you're getting all these comments, that's beautiful, right? And I think that what'll happen is we'll get a better test. I can see, people dating casually, someone that they are really, really excited about tells them they have herpes, and maybe they want to find out if they have it themselves before moving forward with a person,
Mhm.
right? And so there's a lot of possibilities, but I think that my stance on in regards to the asymptomatic testing, if you've never had a symptom, right? Like, how do you know that you have it? And I think that's most people. If you've missed symptoms, then I mean, you have an idea. But if you saw something and you were like, oh, that might be an ingrown hair that pops up every other month for 7 days without treatment and it just goes away, right? I think that a lot of us who are asymptomatic, I don't think it's worth testing because the tests aren't great in the sense of being able to test like that. Like, I mean, if you have physical symptoms, hurry up and get tested like while they're there so that you might even be able to be given a visual diagnosis. But as far as doing the asymptomatic testing, right, that doesn't give you the most accurate information. It just gives you peace of mind of being able to tell that person that is waiting on your STI results before they hook up with you, hey, here's what my results are.
Yeah. I want to talk to you. Last thing is about disclosure and what your advice is for that, because that's a question that we get all the time. And, we're sitting here talking about roughly 50% of the population has one type of herpes or the other. A lot of them probably aren't aware of that, but certainly a lot of people are. And whenever I give talks, I just gave a presentation at Hedonism Resort to a bunch of swingers who I'm assuming have had sex with a good number of people. And I asked them, has anybody ever diagnosed or disclosed a herpes infection to you? Nobody raised their hand. Well, undoubtedly they've had sex with people with who at least had HSV1, right? Like, I mean, it's a given. And so I don't know that people are really disclosing necessarily. But what is your advice for somebody who has either oral or genital herpes, whatever strain it is, doesn't matter? What is really your advice for somebody to have that conversation?
I start with encouraging people to view it just as that, a conversation, right? I think that so many people view disclosure as a confession rather than a conversation.
Mm.
And when we can make it a conversation, it's more engaging, it's more invitational to the other person to also talk about their sexual health history, right? And I think especially in these settings, like these high risk, not risk, but like there's high stakes involved of if I tell someone that I have this, then my community is going to find out.
Mm.
Or if I tell someone I have this and like we play together, that now puts them and whoever else knows out there, and maybe we won't get played with by most people because of having herpes. And so when I speak about being like high risk or having more risk involved, we're talking about not just like having herpes and being rejected, but we're talking about also being excluded from your entire community. So I understand in that case why on the resort, no one was told that somebody has herpes, because I would be concerned that the next question is, what did you do after that? Because most likely, if you're in that part of the conversation, you probably would move forward, because that's also something that is attractive, right? When people are engaging in these conversations, they're very vulnerable in that in a lot of cases. And they're like, huh, I recognize that a lot of people probably wouldn't have told me that. I like and trust you more. Let's move forward. So nobody in that room probably wanted to say that they've had sex with someone who has had symptoms of herpes, right? But yeah, as far as navigating the conversation, it's first to not view it as a confession. And before I forget, I also want to just name for people who might get disclosed to, right? The best way to receive that is with gratitude and curiosity. Oh, thank you. That must have been a little bit challenging for you to share with me. Like, can you tell me more? How are you about it? If you know anything about herpes, right? Like, you can even share, oh, okay, well, I hear that there's like antivirals for something, or if we just wear condoms, or like if you're not having any symptoms, is the risk lower, right? You can ask questions in a way that's not like, well, who gave it to you? Because there's a fine line between being curious and being nosy, right? There's a line there. And so I wanted to drop that in there because I didn't want to forget. But when we do go to invite someone into this conversation, we got to understand the other person may have never had this conversation before, and they have a right to their own opinion. But I like to think that, especially in lifestyle spaces, that it's more normalized to be able to have such a conversation about sexual health, so where you don't feel like that anxiety or that pain in your chest from, oh my God, like I have to have this conversation, because I think a lot of people just don't. And a lot of us are missing out. We're missing out on the opportunity to really get to know somebody through the vulnerability that comes with a conversation around sex.
Yeah, brilliant. Absolutely brilliant. So if the person is showing gratitude and curiosity and that conversation continues, do you ever get into the nuts and bolts of like, yeah, I have genital herpes, but I'm on Valtrax or whatever. I haven't had an outbreak in 14 months. I'm making this up. Like, do you get into that kind of detail, or do you feel like the average person really isn't capable of sorting through that kind of information and making a decision?
I think that there's a lot of things I want to say here, but to keep it concise and as universal as I can,
Okay.
I think that should be, if we're talking about like just, I see you, I'm attracted, I like you, we want to hook up, then we can start with that,
Yeah.
right? But if there's maybe a need for a little bit more, right? Like, we want to talk about sex. What kind of sex do we want to have? There's a little bit of a conversation that we want to assess for compatibility first. But if we're in a space, a setting where it's already kind of like, hey, this is very sex forward, I
Mhm.
think that, yeah, we lead with that. Like, oh, hey, I want to move forward with you in this way. The last time I was tested, it was this time, this day. I got tested for these things. It came back negative. What about you? Okay, all right, you got tested for those things this long ago. Well, how often do you get tested? Or how do you feel about herpes? Like, have you ever been with someone who's had herpes before? Okay, well, is that something that you're interested in? Like, I have had partners in the past who have it. I haven't tested positive, at least not yet. I don't have any symptoms. These are kind of just some of the things that people may say to each other when it's that forward. But if it's more like we're looking at seeing each other again, or we have a relationship, right? We can just get into how fun it could be to do that thing that we've been talking about, and speak about boundaries, as well as talk about safety and talk about right? Like, what's your intention with our time together? And then you can get into talking about the health component because it's not exclusively sexual health either, right? Like, I think about when COVID started, like, we had to really look at what our risk tolerance was and what safety meant for us because it wasn't just our health of our genitals. We're talking about, something that people are dying from.
Mhm.
So I believe that there's a lot to be said for navigating, especially like that time and now, with how much more comfortable we need to be with talking about viruses before we share space with people.
I absolutely love that you said, what were you tested for? Because that's really why I started this company. I realized that when it comes to STI testing, people often just use that blanket term of, I was tested, or, public health people might say to go get tested. And the devil's in the details in terms of what infections you were tested for or not, and even what areas you were tested for and not. And I dare say that's something that most people don't know. I think that if you talk to a really sex positive person who had just told you, oh yeah, I get tested all the time, I just got tested last month, and you handed them a piece of paper and said, write down what you were tested for, they'd probably get HIV. And then after that, it would probably get pretty hazy in a hurry. So, but tests are not the same. And we keep trying to make that point to people. It's not that one is necessarily better than the other, but you have to really think about what sexually transmitted infections, you want to be tested for. Last question is for anybody watching this video, and I think everybody's going to agree that your work is desperately needed and fantastic. How can people support you?
Yeah, people can support me by visiting www.spfpp.org. Oh, here it is. There we go. spfpp.org. I offer one-on-one peer support calls for people who might be struggling with stigma, just need to vent, have a disclosure discussion conversation coming up. If people want to bring me into their medical team to talk about herpes stigma or provide any sort of training or workshops in regards to that, people can contact me for that. I'm a yoga therapist in training. I'm also practicing under mentorship right now, specifically for people who are struggling with and navigating herpes stigma. Those are the main three things that people can contact us for at Something Positive for Positive People. We have our second annual herpes stigma conference. That'll be on May 22nd this year. It's virtual. What we'll do is we'll just have like a day of presenting some survey data and speaking to some of the simulation that we have done to talk about what we're doing to minimize stigma and encourage more stigma-free health spaces for public health professionals, physicians, people who might deliver a diagnosis, as well as those who go on to support people past their diagnosis.
Well, fantastic work, and it's always a pleasure talking to you. Anything else you'd like to add?
Man, I'm also on Instagram at my first and last name, all one word, Courtney Brame. If people want to follow me there, you can check out the podcast as well. I'm always looking for podcast guests to share their experiences with herpes. And I think, yeah, that's it for now. Thank
Okay.
you.
All right. Well, thank you so much, Courtney. Take care.
All right.